Welcome back to the podcast. On today's episode, we're going to talk about addiction, mental health, and recovery. Our guest today is Josh Gotlib of Insight Northwest Recovery. They have a brand new facility here in Eugene that is geared towards the youth, treating addiction and mental health.
We're also going to be sharing about a non-alcoholic lounge that's based here in Eugene. You're going to want to check it out.
All right, let's get into this episode. What's up, Eugene? You're listening to the Eugene Morning Hustle podcast, brought to you by the Eugene Area Chamber of Commerce. We're your hosts, Brandon Miller and Ivan Torres, and like us, we know you'd like to know what's going on in your city, socially, economically, civically, and culturally. From events to guest interviews and professional and personal development tips, each week we bring you stories of local business owners, advocates, leaders, and everyday Eugenians sharing how they've strengthened their roots to reach a little deeper in our community and how you can too. All right, welcome to our interview today. Today we've got Josh Gotlib of Insight Northwest Recovery, and we're going to talk a little bit about what Insight Northwest Recovery is. We're going to talk a little bit about addiction, mental health, and recovery. So welcome to the podcast.
Thank you. I'm glad to be here.
So tell us a little bit about what Insight Northwest Recovery is.
Yes, so Insight Northwest Recovery is a mental health and addiction intensive outpatient treatment program for teens and young adults, so ages 13 to 25. Generally in the community or in the state, you'll see that there's addiction treatment, eating disorder treatment, and then mental health treatment, but rarely are mental health and addiction treatment together. And it's not and it's or. So you're either dealing with mental health and addiction, or you're dealing with mental health. So that's how we look at this, and it's integrated.
And are you finding that that's obviously that it's common, that they're kind of hand in hand, right?
Yeah, I mean, so Oregon ranks one of the last states in access to care for addiction treatment as well as mental health treatment. The overdose rates are very high here with fentanyl. The mental health crisis is impacting teens very high as well. So the research is showing, and in other states, it's very common for there to be co-occurring disorder treatment for addiction and mental health. That's just not an experience here. There's one program in Portland that works with young adults, and I think they work with teens and young adults, but not like older adults, and they do mental health and addiction, but that's one national company, right? So there's very few available, right? So, and it's not a holistic, if we're not looking at addiction with mental health in mind, it's not a full holistic view of what's going on with ourselves, with our patients.
So it's kind of like you're trying to treat two different things essentially. So while you're, in the way that it was working is that you would treat addiction, but then yet there's still mental health happening.
Yes.
That's really impacting even the results that you could be getting from the recovery and addiction, right?
Yeah. So addiction is a mental health diagnosis.
Right. Okay. Yeah.
So if we isolate it and we just look at one thing, we're missing a whole other picture.
You're not fixing the whole thing.
And how does that work? So in most organizations, there are alcohol and drug counselors, maybe a therapist that's running a group and working with patients, or just a therapist with, a population of, a whole organization, like a residential facility would have like one mental health provider. And they see, they're not able to provide care to all of them because there's only one of them.
Right.
So what we're doing is we only have mental health therapists, master's and doctoral level staff that are providing the care to patients. So it's mental health therapists providing addiction and mental health treatment. And then we also have a psychiatrist and a psychiatric provider that provide psychiatry to our patients as well.
So your facility just opened up?
Yes, it's
right?
Open. It's serving patients. We have around 30 people we're already serving.
Wow.
And it keeps growing every day. And we're continuing to hire to keep up with the need.
Where are you located?
We're located on the Waterfront Research Park area, so on Mill Race Drive. Right on campus.
Wow. Okay.
Yeah.
That's a really good space to be.
Yeah, we're really lucky we found it.
So how do you, how are you getting your name out? How are you pushing your, so people know that you're here?
Yeah, that's a good question. So we have a director of community engagement, Michelle Morgan, and she's been super helpful getting us connected to you two, and getting our name out there. And we're meeting with people in the community, whether that's Oregon Youth Authority or 15th Night or Department of Youth Services or any one of these organizations that impacts kids. We're connecting with them.
That's wonderful. So you're saying Oregon is like, the one that has the least amount of resources. Why do you think that is?
Well, so we've been doing this for the last 2 years. We've been putting this together. We're not a nonprofit. We're not grant funded. And it still has been very expensive, and there's a ton of red tape. I would say that there's more red tape when it comes to insurance, health insurance contracting, so that we can bill health insurance. It is complicated and time intensive, and it costs a lot of money to, like, one person can't do it, 3 people can't do it. There's so many different aspects to this, that it's not just getting those contracts and having a space. It's then retaining staff. So there's a huge challenge with retaining staff in the mental health field. Yeah.
So you were also stating you have multiple locations.
Yes.
Right?
So we have 2 organizations. Insight Northwest Counseling is our other organization. And we have about 30 employees under that organization that provide counseling on an outpatient level. So not intensive outpatient, but one-on-one therapy, couples counseling, child counseling, family counseling. We have a location in Portland and Eugene. The Portland location is off of South McAdam Avenue, and the Eugene location is off of Broadway. And so we provide counseling, psychiatry, and psychological testing there. So we have therapists, 2 psych nurses, and psychologists.
Wow.
And the psych testing is also neuropsychological testing. So when somebody, has a brain injury, or, on the other side of that, if it's not a TBI, we also have psychologists that work with academic testing and ADHD, autism, etc.
So what's your connection with this whole thing? Right? Like, what? I'm sitting over here like, okay, you got a lot of going on right now, man.
Yeah.
Like this is not on a whim. This is very thoughtful and calculated, and something that to me feels like something that. What's your personal experience with recovery, addiction, mental health, all that kind of stuff? What?
Yeah. Like, why did I do
How
this?
are you inspired to do this?
So I'm in recovery, long-term recovery from addiction. I got sober and into recovery about 12 years ago. And my experience, I moved to Eugene when I was 20 from Portland, and I was struggling with addiction, and it got worse. And then I was kind of in and out of treatment in recovery houses. I was addicted to drugs. I was using alcohol, abusing it. And my life was pretty much a wreck. I was trying to go to school, and I found a community here of people that went through treatment or were pursuing being in recovery, and it was really beautiful, and I was able to stay sober and have a meaningful life. And through that process, I was like, okay, I want to help people. About a year, 9 months into being in recovery, I got a job at the treatment facility here in Eugene that I went through, and then I worked there for a few years, and then worked at Relief Nursery, doing like peer support and outreach for a while I went to school. And then as I was getting done with my bachelor's degree, I said, okay, well, I think I want to be a therapist, and I don't just want to be a therapist. I'm getting really tired of working in nonprofits and seeing the turnover and everything. I want to start my own business. And then it was pretty clear as I was getting closer throughout my graduate degree, I was like, I don't just want to just be a therapist in private practice. I want to start an organization. I don't exactly know what that's going to look like, but I do want to create an organization that's integrated and that's able to help many people, and combining psychiatry as well as mental health counseling. Because as a therapist, so I got into private practice, and as a therapist, it's really, really difficult, especially in Oregon, I'm going to say Eugene and Portland, to connect any of your clients to a psychiatrist or a psych provider, because everyone's booked out, everyone's busy. It's very hard to coordinate care. So at times I wasn't even able to connect with a psychiatrist in the community or a psych provider because they were so busy with their patients. And it would take 6 months to a year to get them in. So I thought, well, let's see if we can do this in a model that people stay. They want to work here. They want to do that work, and we can retain them, and they're enjoying the work that they're doing, and they're also getting paid, enough to have a career,
right.
which is not always feasible with every part of this field.
Turnover in this field is pretty aggressive, or something where you're seeing people stick around for a while.
In our organization, we have a very high retention rate for our staff. We've had some that have left due to life circumstances, they wanted to do something different in the mental health field. Like we had somebody that went and did medical social work, was like, hey, I'm gonna, this is where my career is going. I have this opportunity, but people aren't leaving to go to do the same thing at another organization, and that's really indicative of what's been created. I think the challenge is that what in the community, if people, especially if they're billing Medicaid or most insurances, if you're a mental health therapist, you're spending quite a bit of time, depending on your time management skills and what systems you have in place for support with that billing, you're going to be spending around 40 to 50% of your time doing paperwork. And so at Insight Northwest Counseling, we don't bill insurance. That was one of the things that we did that allowed us to retain our staff and have them have a livable wage. Insight Northwest Recovery, we're billing all the insurance. We want to really help. This is a more intensive service, and we want to make sure that people have access to it.
Yeah, make it accessible.
Yeah,
absolutely.
we really want to make it accessible. So we bill Oregon Health Plan, Pacific Source, Blue Cross Blue Shield, Providence, all the things.
Yeah. Let's say somebody is dealing with something, and let's say they're in their 18, 20, something like that.
Sure.
And how do they, if they're dealing with something, know how to and where to reach out and how to navigate that sort of thing? Because if I think about it, when I was that age, I wouldn't have known how to even start talking this language,
Sure,
right?
sure.
About insurance and about paying for it, and that I don't even know what's wrong, what's going on in my life right now. I just want to talk to somebody.
Yeah. I think the beautiful thing about Insight Northwest Recovery is that we're not just focused on addiction. So if someone's maybe they don't have an addiction issue, maybe they're coping with alcohol or substances, and it's an underlying mental health concern, So if someone's to get connected with us, the easiest thing to do is just go to our website, insightrecovery.com. The great thing if for students is that we're not connected to the University of Oregon. We don't release any information to them. Everything is confidential, and it's completely separate from their schooling at Lane Community College, Bushnell, or U of O.
Okay.
Yeah, and when people call us, it's very simple. They get set up with an appointment within 10 minutes. If they are insured by their parents, they're going to be insured until they're 26. We can figure out that part. If all they know is their insurance plan, we can figure that out.
Sure.
If they want us to check in with their parents, we'll check in with their parents. Very simple.
Easy.
Yeah, very easy.
That's nice. Yeah. It's supportive rather than I don't know, you got to figure out the paperwork and get back to us,
and we do all the paperwork in person. And it's actually
great.
not paperwork. It's just signing with your finger on an iPad.
Oh, yeah. Times have changed.
Yeah.
So when I was a teenager, I went to an addiction behavioral health center, inpatient treatment, and hitting that bottom, right, which kind of forces you to decide, okay, there's a fork in the road.
Mm-hmm.
How are you able to help somebody that's going through something like that, and they're not sure exactly which path they should go down, and
Sure,
it's like that internal struggle, right?
Sure. Yeah. So with especially, let's say, people under the age of 19, 20, it's 18. It's really about delaying use. It's not about abstinence. It can be for a period of time, but that's a really, really strong expectation depending on the life circumstances of somebody, depending on how much trauma they've experienced. But because the brain is still developing till the age of 25, the research shows that delaying use is the most effective thing. So if somebody, uses once in 6 months, that's a huge win versus, maybe it's extreme and they've been homeless and they've been using throughout the day, every day, or they're, after school, they're using every day with their friends. Depending on what their life looks like, if they've delayed use and it's a lot less, that's a huge win. So it's we look at it differently than abstinence. And I think that's where the field is going, is what it's called harm reduction. And it's more of an individualized look at someone's care and what their context is and what their goals are. Right.
I think that's huge. I think that's definitely a shift from, when I was a kid.
Oh, yeah.
That was definitely not the message. The
No.
message was abstinence. If you don't stop, you're going to jail. That kind of thing,
yeah.
And now what you're saying is that it's a little bit more collaborative and supportive and
Yes.
and realistic.
Yes.
Right.
And some even young people, should get into recovery in the abstinence form.
Yeah.
But they may not figure that out until they're older, or they may figure it out when they're 17. But delaying use is going to help their brain function and develop to make those decisions, later in their life when they're adults.
And there's solutions out there. There's alternatives and things like that I've seen, and it's a movement. Non-alcoholic lounges and things like that. I mean, it's a real thing.
Yeah.
And yes, folks could say, well, it's just you're paying for juice.
Sure, sure.
But what you're really paying for is the atmosphere and the camaraderie and things like that, right? And that ends up being an outlet for some of these folks who are like, maybe they are 21. Their friends were going off doing their thing, and they're feeling alone and like, I'm trying to battle this thing, but I don't know. I don't have this support network, right?
Yeah.
There are outlets like that too.
There are supports. They're limited in the city of Eugene. If you're looking for, there's a lot of AA meetings here with the young people that are getting sober, but that is also a very focused view of abstinence. So there's also refuge recovery that looks at addiction and mental health challenges differently through a Buddhist lens. And there's also smart recovery, which is looking at addiction in a different way too.
Speaking of the youth, what kind of things are you seeing here in Oregon? Like, is it a big issue?
Yeah. Yeah. It is. Yeah. I would say nationwide, and I think it's mainly impacting youth based on Gen Z is the first generation that has grown up with their phones. And so they're spending, anyone that spends 6 hours a day or 4 hours a day on TikTok is going to have mental health challenges. Especially depending on that algorithm, it could, because when someone, and then they start, feeling depressed, and they start looking at things that are depressing, it's like a snowball, and it's going to keep showing very depressing things.
Whoa, I didn't even think of that.
Yeah.
So, so is that something then you guys help with, addiction to phones type stuff?
I mean, so addiction to phones it's different than a substance addiction, right?
Right.
It's going to look at it. We wouldn't necessarily look at it as an addiction. I mean, who's not dependent on their phone, right? At this day and age, the way we look at it, I mean, we collaborate with parents. We do family counseling. But we have to have that parent collaboration depending on the context of the child, and if they're living with guardians or parents and what their involvement is and what's going on in the family. But during group and during our sessions, phones are put in the other side of the room. We don't touch them, like the facility doesn't touch them, but they do turn them off and put them in the other side of the room so that we can be present and focused on what's going on in front of us.
So as a parent, let's say they have a kid in college, right?
Yeah.
And how do they become aware of problems with their child? Whether they live here in town or they live out of town, how are they able to see signs of something and be like, I don't know, that seems like that's concerning. I should reach out for help or advice.
Yeah.
Like, what should they be looking for?
Yeah. I mean, if your child isn't responding to text messages or calls, or is sleeping in really late, or skipping class, talking about being vague about what they're up to, or if you're noticing a shift in their hygiene, or just kind of lackadaisical or apathetic, depending on if that's addiction or mental health challenges. And I think parents have a good gauge on if they're especially if the child's going off to school in a different state, they're gonna be concerned is my child making friends, and they'll, if that's not happening and they're very isolated, that's a huge concern. Yeah, that's a bad sign.
So how do they have that conversation with their kid and be like, hey, so I've been noticing that you're kind of stuck at home all the time, that sort of thing. Like it's an awkward conversation, right?
For sure.
And it's like, and how do you loop in a professional, right?
Sure. It really depends on this, the severity.
Yeah.
Is somebody suicidal? Is somebody, to what extent are they struggling? It would depend on if it was so intense that they would need intensive care, or they just need to connect with, and I don't say just, but if they need to connect with a therapist, finding a therapist, whether that's going on our other website, insightnorthwest.com, or Psychology Today, finding somebody. But having a conversation could just be asking, do you need support? How are you doing? Do you need support? How can we help you? Rather than like this, it can be very, you want to keep the door open and not put the child or a person on, in defense, on the defensive.
Right.
And if they say no?
I mean, I think the challenge is, it depends on the family, cultural background and context in terms of how they, connect with their kids. But I think in terms of like, a generic American family would be, there would be some very individualistic step away and let the, young adult make their decisions.
So let's say that a parent notices something's wrong. They've talked to their kid about it, and now the kid has to make up his mind, or his or her mind, or whoever, and figure out what to do. Now there's this big stigma with mental health, addiction, all that kind of stuff. Taboo, uncomfortable, all those words fit that. How are you approaching that?
I think the parents can also, they can let, not just how can I help you, but like, here's the resource when you're ready to call. There's also 988 when someone is struggling. Is the suicide hotline. And there's the crisis text line. So in terms of stigma, my hope and what I'm seeing, and I also recognize this is my perspective and my context of what I consume in media and the conversations I'm having day to day. But I see that stigma is decreasing and mental health is a huge conversation. Addiction, still tons of stigma, especially in the state of Oregon with Measure 110 and, the houseless crisis and
right.
all of that. That's still very stigmatized. The thing that's helpful in terms of the treatment that's being provided by any organization is that it's protected by HIPAA. So anything that's, that's a federal law, they can't release the information. It's very private. What's in our organization is no different than that.
Okay. Yeah.
It's very confidential. Just as I mentioned,
right.
If they're a student, the university's not going to know unless there's specific information that we, the client consents to having released to the university or college.
Okay. Nice. I was on addictiongroup.com or .org, and they had just put out an article like 2 or 3 days ago.
Okay.
And they said Oregon has the worst drug addiction rate in the country, with 9% of teens and adults addicted to drugs in 2022.
Yeah.
2020.
Yeah. And I don't want to just
crazy.
look at the drugs, because I think people
right.
can look at just people on the street, and it's actually not. It's like high schoolers and everyone.
Yeah.
A lot of people are using substances that don't seem like they are, functioning in society.
Yeah.
Right.
And potentially experiencing an overdose from fentanyl. So, but the mental health piece, I think that's what. Are you too familiar with Jonathan Haidt?
Not sure.
He's a professor out of NYU, Stern,
Okay.
and maybe not Stern, but I think he's at NYU, and he's a psychologist that focuses on the research of mental health in young adults and teens. And his new book that he just came out with is about the kids are not all right. The kids need a lot of help. The delineation that he has between millennials and Gen Z is that millennials had at least somewhat of a break until social media. Social media came into focus around, maybe they were 17, the really, really young millennials, 17, 18, but now the teens are on, social
Way earlier
media
than that.
at 14 years old.
So with social media, what do you think is the impact there? Is it just the being on there and comparing their life and that causing like that mentality on it? Or
I mean, I think there's so many things because it's not real life of Facebook. But if they look at Instagram and they look at TikTok and they see their friends doing something and they're not invited to the to what's going on, then it creates this dynamic where it's very simple to bully people to each other and sending very specific messages through Snapchat, through TikTok, through Instagram. It's the primary way they're communicating and experiencing their social circles is through
which is, I mean, I just find it wild. I mean, I didn't grow up in having social media when I was a teenager, but maybe MySpace came out at some point. But
yeah,
some of you listening know what MySpace is. So the rest of you, just go look it up. It's on Wikipedia. But when it comes to social media, we're talking about the primary way of communicating is through chatting and pictures and video and all that kind of stuff, and getting immersed in other people's lives. Glimpses of other people's lives, some of which may be even made up. Who knows, right? That being very damaging because of not having this in-person interaction, right?
Especially during COVID.
That's what's causing that. And COVID being, kind of a catalyst for likely some of this mental health and addiction, right?
Yeah. I mean, being alone at home for, what was it, 2 years, year and a half? Something like that. I mean, that's a huge impact to what's going on now and trying to, that developmental stage, being at home, being isolated, disconnected from friends, and now trying to get back into their life. It's really impactful. And then not having that level of stimulation of interacting with people, or not, being 12 years old and then out of the pandemic being 14 and not, in that huge developmental stage.
Oh, yeah.
That's a big gap of time.
I couldn't quite imagine that, but I think about having those conversations with your peers, I guess, not having the human interactions that should happen. And I wonder, we were talking a little bit about people being like attacking in comments and in social media, all that kind of stuff. Bullies, right? The bullies that we dealt with when we were kids, yes, they push you into lockers, that sort of thing. Yeah. But we're talking about something that is way worse, which is the social media aspect of people looking into the comments and their DMs and seeing things that are probably so horrific that people wouldn't even say in person.
Yeah.
As a bully, right? Yeah. And this causing a lot of resorting to drugs and alcohol, resorting to, other behaviors that aren't helping you. I have to think that parents feel alone.
Yes.
With this.
The research that's coming out and the push right now is to delay cell phone use until the age of 16.
Yeah.
Or, between the age of 16 and 17.
So we talk about the delay of when you're 16 or 17. Well, I remember when I was 16 or 17 and I wanted something and all my friends had it.
Yeah.
I was going to get it. That has got to also be detrimental to the kid, right?
That's also the solution, that if everyone's delaying getting a phone, if every parent is delaying getting a phone until the age of 16 or 17, then there isn't that pull by the kids to see their friends. Their friends don't have it. They don't need it either.
Yeah. Is there a movement happening that's advocating for that? Is there something that the government is looking at? Is there something that is happening where people can get behind it and say, we as parents are going to get behind this?
I'm not sure if there's any specific. I mean, I know that this is a talked about thing. I know if you ask most parents, or if not every parent of of a child that's over 13 with a phone, they would rather their child not have the phone.
Yes.
Or have a flip phone. Just something that they can call them on. there probably is a movement. I know
Yeah.
that in Florida they just passed a bill for phone-free schools, phone-free high schools.
Oh, wow.
Yeah. So I don't exactly know what that's going to look like, but
Yeah.
that's where the largest problem is if everyone's looking at their phones, they're not.
You deal with a range of severity, right? So something that is, and I would say treating all of these equally, as they're all equally important.
Yeah.
But the severity being like somebody who is a teenager who is using meth daily, to somebody who is dabbling with alcohol here and there, and using that to cope with maybe bullying. How do you approach that, and having kind of a customized way or a more personalized way of working with patients or people who aren't patients yet? And how do they know to trust you and be like, I don't want to just be given a packet and say, fill out this packet, and then afterwards you get your 6-month chip or something like that,
Yeah.
you know?
Yeah. So we have individualized care at Insight Northwest Recovery. We're focused on providing, individualized psychiatry, individual counseling, and then depending on the context of the family, if it's appropriate, doing family counseling as well. So the experience for, let's take addiction and mental health. If someone goes into a residential program or any kind of, intensive outpatient program, they're going to be, interacting with people that, no one's pain is greater than each other's, right? No one, we don't want to measure trauma. We don't want to measure how,
Right.
The experience of someone's pain, but on the outside looking in, someone could have a more challenging or severe, like you mentioned, experience with addiction or mental health, but they're all still equal.
Yeah.
So
Yeah.
there really isn't, I think, and this theory of that there's a bottom.
Yeah.
The bottom
right.
is where you stop digging. It's not, you hit the bottom and then you can just stop and
Sure.
you've learned your lesson. The bottom just keeps on going.
Yeah.
There's always a new bottom.
True.
For whether that's mental health or addiction.
So I'm curious about somebody who doesn't know they need help.
Yeah.
How do they know?
How do they know?
How do they know? How do you know when it's so bad? How do you
Yeah.
know it's bad enough? How do you know, like, if your life is destroyed, or if, like, well, I still got my house, or I still got the place I'm living, I still got my car, but I'm supposed to wait until things are that bad, and they're not that bad.
Yeah, I think
right?
that's the beautiful thing about, destigmatizing addiction and mental health challenges is that we don't need to wait until it gets so bad that someone's life's destroyed. They can still have their job, they can still have their family, they can still have the house and the car and the garage, everything, and they can get that help. Usually the most indicative thing in someone that's struggling is if their relationships are starting to be impacted. So if someone's really isolated, that's really difficult. But if someone's around a lot of, has a family or has friends or coworkers, and there's red flags, and people, are distancing themselves, or that person's really difficult to be around, that may be the challenge. Or
what are some of the stigmas with mental health and drug addiction that you're trying to kind of get rid of? Or
yeah, I think that one of the aspects to Insight Northwest Recovery is that it doesn't feel punitive when you go in. Like, it doesn't feel like, oh, I really don't want to be here, and this is where people go when they're in trouble.
Yeah.
Like, it's like the second stop from jail.
Yeah.
That's generally the experience.
That's where I went. That's where I went, by the way.
Yeah.
It was not great.
Yeah. Yeah, in the experience when people come in there, it's not like, hey, I want to stay here
Yeah,
forever.
right.
They get to go home every day. But it feels like it's breathing life. It's a community. It's people are smiling. There's light. That's really important. The experience with stigma, let's say, locally, I think in Oregon, we have a really unique makeup with addiction specifically, is that we legalized drugs a number of years ago, and everyone has an opinion about that here, and that has that is one aspect to addiction. That is one piece of it. There's, like we just were talking about, addiction could happen in any community or be impacted. Anyone could be impacted by addiction. It doesn't discriminate. So I think that's where the attention needs to lie, is that is that it's high schoolers, it's college students, it's adults, it's, there's so many people that are impacted by addiction or know someone that's impacted by addiction that, removing the shame out of it's really important. And,
Right.
and I would say it's the same for mental health. I think the challenge is with mental health is people don't exactly know, it gets to the point where someone's suicidal or has an attempt or something like that. It's a bit more maybe vague when someone's having an experience that, or maybe they're very isolated. So people don't really know what's going on. That's what I mean by vague, is that it's
Okay.
like, I don't know how this person is doing.
Right.
Maybe they're just really busy, that kind of a thing. So I think that people talking about it, just like what we're doing, is going to be the biggest help, is just, putting it out there. That people, it's not, it's great that in 2024, when someone says, "Oh, I don't have a therapist," or "I've never been to therapy," people are like, "What? You've never been to therapy?"
Yeah.
You don't have a therapist?
It used to be like, "Oh, you're going to therapy? Oh man, something's wrong with that person."
Yeah.
Absolutely.
Seriously,
Yeah.
seriously, that's the way it was.
100%.
Absolutely.
And now it doesn't feel like that.
No.
Now it feels like, well, you don't have a therapist. That's weird.
Yeah.
How are you?
Totally.
How are you doing?
Yeah.
Like, it's like the baseline anymore.
Yeah.
Yeah.
Alrighty, everybody. So we're to the part of the show where we get to know our guests a little bit better. So rapid fire questions coming your way, Josh. When you're not working, what are some of the things that you like to do?
I like anything with wheels.
Oh.
So motorcycles,
Yeah.
dirt bikes, mountain bikes. I'm out there having fun.
Just street, or do you actually
Dirt
go
and
there?
Oh, nice.
Yeah, dirt and
Sweet.
street. Yeah.
Excellent. Night or day? Are you a night owl or
Right now, night.
night? Mountains or beaches?
Mountains.
If you were a season, what season would you be?
Fall.
It's a common theme.
Are you reading anything currently?
I want to start Jonathan Haidt's new
Yeah.
book.
Yeah. What's the name of it?
I believe it's The Kids Are Not All Right.
Okay. Yeah.
Yeah, I believe, but I might be wrong.
Nice. We'll link to that in the show notes because
Cool.
I think people will be interested in that.
Cool.
So, yeah.
First concert you've ever attended?
Oh, I forgot.
Yeah. Yeah.
I've only been to like 2, so if you asked me, I would know right
Yeah.
away. What was the first job you ever had?
TJ Maxx.
Oh.
Nice. What is your most used emoji? That was really close. What's your most used emoji?
Probably the smiley face with the thumbs up, or
Oh yeah.
I know that's really boring.
Yeah.
Mine's the fire.
Okay.
Fire.
I will confirm it is the fire.
Everything's always on fire.
Everything. I'm like, I just need a response, and you're like, fire. I'm like, whatever.
You're like, okay.
ahead.
It was a yes or no question. Fire. What is your hidden talent?
Hidden talent. I don't know.
What is your most useless talent? Flip on that.
I'm extremely good at using one of those ripstick waveboards.
Oh.
Yeah,
What?
I can
Dude.
rip it.
I've never been good at that. That's
Wow.
that's a talent.
I like
that's
that.
a talent.
Yeah.
Alrighty. You want to hit on any of these or?
I just got one question, and it's I'm saving it for the end.
Oh,
Yeah,
okay,
yeah.
okay. If you had one thing to eat for the rest of your life, what would it be?
Thai food.
Dude.
Ivan has a place he wants to share with you. You were telling me about a Thai place recently, right?
No.
No?
Little Elephant. They've been there? Little Elephant?
I have
At
never
Cold
been
Fire?
Oh, that sounds good though.
It's good.
Yeah?
That's really
Oh,
good.
What's your
Okay.
favorite plate there?
I've only gotten pad Thai. Pretty lame.
I love pad
But
thai.
it's so good.
It's so good.
I
Yeah, it's
will
pretty
always
good.
find
Yeah.
pad thai. Sabai, that's where I had pad
Okay.
thai. I really
Yeah.
like
Okay.
it.
Yeah.
Sabai noodles is what that's
Yes,
called.
it's really good.
So
It's so
fire.
good.
So good. So good. What is the best piece of advice you have ever been given?
Just do it.
Just do it.
Just go for it.
Who gave it to you?
Besides Nike.
Okay, there's this wild video of Shia LaBeouf. And he's behind a green screen, and he's just screaming, "Just do it!" Just do
it. Yeah.
Oh yeah.
Okay. I just got sent that to me like 2 days ago, so I could totally pull it up right now. Yes. It's like, here's your motivation for the day. Just do it.
Yeah, it's like a 5-minute video of him just saying, like, "You got a problem?" And he puts it in his hand. And he's like, "Just do it." Yeah,
I love that.
All right.
So my question is what is a hidden gem in Eugene that you feel like somebody that's new to the city and you're like, you seriously have to check this place out because this is like my little hidden gem and you have to go check it out. It's so cool. It could be anything. It could be a park. It could be a restaurant. It could be a retail establishment. It could be anywhere in Eugene. What's a place that comes to mind when you think a hidden gem, someplace that's just really special in the city?
Yeah, so I always tell people to go walk through campus.
Okay.
And I know that's not really hidden, but especially when, right now when the trees are blooming and the flowers are blooming and it's, walking near the night library and that, between night library and the Lillis business complex, it's just, there's nothing like it.
Yeah. I absolutely love that you said that because I actually was invited to go just walk the campus with my pastor not too long ago. Yeah. And it was just the most peaceful walk. And it was just really neat. I didn't know that I was allowed on there, to be honest. That's why I'd never done it. So I was just like, all right, I'm here.
It's federal property.
Let me see your student pass.
We pay for it.
Absolutely. I don't know. I was just like, I'm not enrolled. What are you doing? But that's awesome.
Yeah.
Cool. Well, that's awesome. Well, yeah, we'll have to encourage all of our viewers and listeners to go and just take that walk.
And there's a ton of mountain biking around here.
Oh,
for anyone that's outdoorsy.
Have you gone to Y Pass?
Yeah.
Oh, dude, it's so good.
Yeah.
Favorite trail for mountain biking?
Alcee Falls.
Oh, yeah. That's a good one.
Yeah.
Excellent. Well, is there anything you want to share with our viewers? Any message, anything that you're like, man, I really wanted to talk about this? Or if there is, we can still talk about it. I mean, but
yeah, I think that help is available.
Yeah.
Help for mental health and addiction is out there and available. Yeah.
So if our listeners want to learn a little bit more about Insight, how can they find you?
InsightRecovery.com.
Okay.
Yep.
Yeah, we'll link to it in the show notes. Yeah, that's pretty easy to remember.
Yeah.
Maybe I don't need to link to it. You'll remember that. Come on.
They can book a consultation with us where we will give them a call at their preferred time. It's right on the homepage. It says book a free consultation. So we make it very simple for people to get in contact with us and get help.
Alrighty, Josh. Well, it was great having you here. Thank you so much for stopping by.
Thank you.
Yeah, we'll link to the website, insightrecovery.com, Insight Northwest Recovery. All that information will be in the show notes.
Wow. What an insightful conversation.
I know. It was great having Josh on the podcast here today. Our youth there's an epidemic, right?
Absolutely.
Mental health, addiction, and I didn't even really realize that social media was such a problem.
I
knew it was, right? Like you can see it in like the comments, trolls and stuff like that, bullies and all that. But I didn't grow up in a time where I had a smartphone, Snapchat, and all that other kind of stuff in school. I couldn't even imagine. It is got to be isolating to live that.
Absolutely.
Live like that.
Not only the perception too that your life is not nearly as good as what somebody else's on Instagram is, and that's totally baloney too, because a lot of that is fake. So, it's really eye-opening to hear all that.
Yeah, and speaking of, addiction and recovery and, the challenges out there, I mean, people are interested in making lifestyle changes too, right? Sometimes it doesn't mean that there's always a problem to be solved. Sometimes you just you're sober curious, right? You're just interested in what else is out there. Maybe you need a break from the bars. Maybe you need a break from, the different beverages out there in the scene. And something I found recently was this, did you know that there's a non-alcoholic bottle shop and tasting room right here in Eugene?
I did not. I didn't even know that was a thing.
Yeah, High Street Tonics. I didn't know anything about it, but I was curious after we had talked with Josh and all that is there actually a place that has that available? And there certainly is. I don't know about you, but that is something that I want to check out.
I didn't realize those were things. I mean, that just sounds like the perfect place if somebody's trying to make a lifestyle change, because one of the things that I feel like a lot of people look for when they go to the bar is to try to meet people and all of these things. Well, you still have the location without having to all of the alcohol there, right? And it's not that alcohol is bad, but if you're having an issue with trying to control it, or it controlling you, man, just what a great opportunity it is.
Yeah, I think that's the thing, is that sometimes it's not always about like having a major problem in your life.
Yeah.
Or sometimes the major problem is the fact that you don't want hangovers anymore, and you don't want any of that, and maybe you just want to shake it up a little bit. These places are there, and it seems like a really cool place. I saw that they had non-alcoholic spirits, craft beers, wines. They had something called a functional elixir. I have no idea what that is, but I'm curious to check it out.
Cool. Well, check it out. Let us know what you think.
I will.
And maybe bring one in.
That's a good idea. Maybe I'll bring something in, and we'll taste it and share it with our listeners and viewers. So,
cheers to that.
Well, that's our show for today, and we'll see you all next time
on the next one.
This episode of the Eugene Morning Hustle podcast was brought to you by the Eugene Area Chamber of Commerce and sponsored by Ivan Torres of Business Block Studios and Brandon Miller Voiceover. Don't forget to subscribe to our channel where you get your podcasts, and follow us on Instagram, Facebook, and LinkedIn to stay in the know. If you have any questions, topics, or guests you'd like us to dive into, send us a voice message on the Eugene Chamber Instagram page, and we'll feature you and your question on a future episode. Or shoot us an email at podcast@eugenechamber.com. Till next time, Eugene.